Hi friends, I am Dr. B.V. Rao of Pusha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the diseases of female urethra. The diseases of female urethra are urethritis, trichomonas vaginalis urethritis, senile urethritis, prolapse of urethra, urethral stricture, urethral diverticulum, calculus, urethral caruncle, papilloma accumulata and carcinoma of urethra. Urethritis. Acute urethritis may be gonococcal or non-gonococcal urethritis. In the same way, chronic urethritis may or may not be due to gonorrhea, and to severe form it is a erythrotrigonitis. Clinical features: increased frequency, pain on micturition, urgency, terminal hematuria and low back pain. Urethral tenderness is due to infection of skinous tubules. Pressure on the urethra causes pus to exude from the orifice of the ducts surrounding the urethral opening. Incomplete cure of the infection in these tubules causes chronicity in anterior urethritis. In case of posterior urethritis, urethral polypi are often present and can be seen on urethroskopy. Treatment: antibiotic and local treatment is to be done. In gonococcal urethritis, furosin urethral suppositories are good selection. Intermittent dilatation of urethra by promoting drainage of infected foci within urethra helps to cure the infection. If polypi are present, the condition is seldom cleared unless they are removed by fulguration. Swabbing the urethra with 10% solution of silver nitrate is also helpful. Excision of distal 1 cm of urethral mucous membrane is the best method of curing chronic infection proved to be due to infection of skinous tubules. Trichomonas vaginalis urethritis. In majority of cases, T. vaginalis infection must be regarded as a venereal disease. The way in which the remaining patients get infected is speculative. Lavatory seats are usually blamed and their culpability is almost impossible to disprove, for T. vaginalis can survive thereon for 45 minutes. The fact that virgins are never infected with this protozoa. Trichomonal vaginitis is complicated by urethritis in many cases, and this urethritis responds to metronidazole, but the vaginitis must also be treated. Senile urethritis. It is an atrophic lesion due to deficiency in endogenous ovarian hormone. Treatment: suppositories containing diethyl stilbestrol 0.1 milligrams in a topical anesthetic agent are extremely effective. Prolapse of the urethra. After the menopause, many women have prolapse of posterior margin of urethra. It is symptomless unless associated with senile urethritis. Due to straining, it is progressive. Prolapse of urethral mucous membrane occurs as a congenital condition. When more than half of the circumference prolapses, the discomfort in walking is proportionate to the prolapse. The urinary meatus when straining, if prolapse is complete, the opening of urethra is central. If it is partial, urethra is eccentric. Treatment: the urethritis must be treated first Lesser degree of prolapse can be cured by making one or more linear grooves in the long axis of mucous membrane of urethra with a diathermy needle, employing the coagulating current. Subsequent contraction of the scar reduces or obliterates the prolapse. More advanced cases can be treated by transfixing the whole thickness of the prolapse as far from its extremity as possible, with 4 catgut sutures placed at equidistant intervals. A redundant urethral mucous membrane is excised distal to the sutures. It prevents retraction of the stump into the canal. The cut edges of the mucous membrane are then united. Urethral stricture. An adult female urethra which fails to admit a number 20 French bogey is the seat of urethral stricture. Causes: gonococcal or non-gonococcal urethritis, trauma. As in difficult labor, inflammatory stricture is situated at external meatus. Traumatic stricture usually in the middle or posterior part of the urethra. Sometimes the stricture allows only the gite, and in such cases the acute retention may occur. Dilatation of stricture yields satisfactory results. Urethral diverticulum, erythrocele, congenital, may be developed from Gartner's ducts, but some may be acquired by rupture of distended urethral gland or injury of the urethra during the parturition. Clinical features: a small uninfected pouch may be symptomless. A large diverticulum causes inability to pass whole of urine, or dribbling may occur. If infected, recurrent attacks of cystitis perpetuated by reinfection from the diverticulum continue in spite of antibiotics. On digital examination, a swelling can be felt on the anterior vaginal wall in the line of urethra, and when it is compressed, the urine coming out is purulent. If a beak of a curved metal bogey is passed gently along the floor of the urethra, from time to time the orifice of the diverticulum is large enough for the beak to enter the sac. In some cases, a stone may be formed and causes hematuria. Treatment: to open the diverticulum through an incision in the vaginal wall. After irrigating the interior of the diverticulum, the mucous membrane is curated and the cavity is packed lightly with oxygen. The incision in the diverticulum and vaginal wall is then closed by interrupted catgut sutures. An infilling catheter remains in place for a week. The fibrosis obliterates the sac. From excision of sac is reserved. Formal excision of the sac is reserved for diverticulum with wide mouth. Calculus. Impacted calculus in female is exceptional. When it occurs, can be removed by grasping it with forceps, keeping the finger on the vaginal wall, press it forwards. Urethral carbuncle. It is present in middle-aged and elderly women. It present as a soft raspberry-like pedunculated granulomatous mass about the size of a pea, attached to the posterior urethral wall near the external urinary meatus. Clinical features: frequency of micturition, dysuria, pain during and after micturition, bleeding. There is a terminal hematuria, and there may be blood-stained discharge independent of micturition with a probe. It can be determined the parturition arises from the pedicle attached to the posterior urethral wall. The mass is tender and readily bleeds. Treatment. The pedicle is divided flush with the floor of the urethra with a diathermy needle using a cutting curette. Then that portion of urethra from which the pedicle arose is coagulated with the diathermy current. The chronic urethritis, which is always associated, should be treated by furosin suppositories and intermittent urethral dilatation until the patient is symptom free. Papilloma acuminata. It occurs on the external urinary meatus and spread over the labia minora. In some races, females they increase at an alarming rate during pregnancy. Towards the term, so great does the neoplastic mass becomes that it may obstruct labor and necessitates caesarean section. Carcinoma of urethra. It occurs twice frequently in female than males. A visible bleeding protrusion is a common manifestation of carcinoma of urethra. The commonest site of carcinoma is its early stages is external urinary meatus. If it starts within the urethra, causes dysuria, hematuria, and retention of urine. The presence of induration differentiates it from innocent tumor. Treatment. Interstitial irradiation by gold grains or radium needles is the method of choice. If this fails to cure, the advanced state of the disease necessitates total ureterocystotomy. That's all about the diseases of female urethra, and in the next video I will discuss about some other disease.